Okay, this recording is your pre-lecture recording for Chapter 4. We're going to talk about distinguishing the RN role from the LPN role. I might see LPN or LVN kind of interchangeably, just kind of whatever comes to my mind first. So first we'll talk about the role transition. If you're in this class, it's because you're transitioning from the role of the LVN to the role of the registered nurse. A lot of research has been done on the professional role socialization, and researchers have found that there are 6 main factors that will affect your transition. I want you to be intentional about creating a sense of belonging with your fellow classmates during nursing school, and you can continue that after graduation as you move into your career as an RN. You may have experienced in LVN school that some of what you learn does not match or is incongruent with what you experience in the field of nursing. You will probably experience that again in RN school. This can make it difficult to answer test questions or integrate what you're learning into your practice. It can make for a tough transition. For some of you, it has been some time since you were in nursing school, so the best practices that you learned at that time may not still be the best practice. Another thing that affects your transition is your understanding of your role based on how people treat you. People may start treating you differently based on your new license, and you also must recognize yourself as a registered nurse for a successful transition. The last component affecting your transition is your RN school clinical experience. Your instructors aim to recognize your prior experience and your prior knowledge and skill and encourage you to build on those strengths. If you ever feel insulted because someone is not recognizing your prior professional expertise, just remember that in some practice environments, the differences in the roles of the LVN and RN may be small, but in other environments, they might be very great. And it will be up to you to notice and define the differences sometimes. So when you have those negative feelings, just take a deep breath and continue forward, knowing in your own heart the vast learning that you have already acquired, and be proud of your new efforts. In my experience as a nursing instructor, I have found that many LVNs are going back to school for their RN. They do struggle in clinical, especially preceptory clinicals, with practicing as an LVN in a facility one day and then going back the next day as an RN student in the same facility. That can be really difficult. Also, students that work in other areas of healthcare may struggle. So, what exactly is a registered nurse? There are many role elements that represent what an RN is. Primarily, we are care providers. We ensure the best possible health for each of our patients. We provide the care that each patient needs. A counselor provides guidance and support for patients and families who are experiencing alteration in their health state. An RN must assess a patient's emotional struggles and address those. The role of the nurse as an educator is to provide patient-specific information about medications, diet, treatments, etc. We also operate in roles where we demonstrate more formal teaching skill, such as teaching classes, including CPR, or running groups about breastfeeding, or working as a diabetic educator. Those are just a few examples of the many, many ways that nurses educate. Registered nurses act as managers, both in healthcare and outside of healthcare. An RN might manage a group of other nurses, CNAs, and others, but they also might plan, manage, and coordinate groups of patients, families, and communities to reach health goals. The RN as an advocate is becoming more important each year as our patients are living longer, and we are taking care of patients with ever increasing acuity. New medications and the new medical treatments are introduced, and patients have a right to understand their treatment and make informed decisions. It's the RN's duty to stand up for the patient's rights. The RN must work with members of the healthcare team from other departments. The doctor treats the patient's illness, and the nurse treats the whole person. We are the healthcare worker responsible for the patient around the clock. We have great breadth and depth of knowledge, and we function to collaborate with all the other healthcare team members and make sure that the patient has optimal care to help them heal. We are collaborators. As professionals, we function as change agents. We sense needed changes and we become informed about best practice. We identify problems and enthusiastically work to make change. The registered nurse has the unique opportunity to be a role model for other nurses. As we progress throughout our careers, we have the opportunity to become mentors or trusted advisors for more novice nurses. The registered nurse is inquisitive and a researcher. He or she investigates possible causes to patient problems, but also solutions. And we investigate solutions to unit problems and hospital problems. It's the responsibility of all nurses to practice evidence based care. And more recently, the RN has functioned as an entrepreneur, opening their own business directly associated with healthcare. Or sometimes they even act as consultants for other businesses in healthcare. The sky really is the limit for registered nurses. All right, next we're going to talk about the differences between LPN and RN roles. People oftentimes will get tempted to believe that there are minimal differences between an LVN and an RN, but there are many RN role elements that might be hugely different in daily practice if we really take the time to think about it. The American Nurses Association considers the LVN role to be a quote directed role, meaning that LVNs perform tasks under the direction of an RN or by orders from a healthcare provider. So the minimal expectation of an LVN does not require the LVN to have worked, to use critical thinking to the same degree that is expected of a registered nurse. This doesn't mean that LVNs do not use critical thinking. That is far from the truth. What it means is that it's not required to the same degree that is required by RNs. I have worked personally with many LVNs across several settings that demonstrate critical thinking to a great degree. RNs practice with more independence and autonomy. So instead of practicing in a directed way, an RN is expected to learn the why of what we do. Critical thinking is required and expected. RNs perform the initial assessment, and then the Nurse Practice Act and the facility will determine the type and frequency of assessment that RNs and LVNs perform there on out. In some facilities, RNs do all of the physical assessments, and in some, the RN has to just assess once every 24 hours, and then there are other variations. So the point is that the RN is expected to do a more thorough head-to-toe assessment in situations where medical decisions will be based off of that assessment. Initial care plans are initiated by the RN, and the RN must oversee the implementation and evaluation of the plan. There's got to be collaboration between the LVN and the RN so that the patient has been provided with appropriate care. If there's not communication or not good enough communication, things may fall through the cracks, and we don't want that to ever happen for our patients. LVNs and RNs have very different roles and responsibilities legally as well, and RNs are typically placed in positions of leadership because of those differentiations. And in fact, the state of Texas has a Nurse Practice Act for RNs and a separate Nurse Practice Act for LVNs. So for scope, the LVN is responsible for providing safe, compassionate, and focused nursing care to assigned patients with predictable healthcare needs. Whereas the RN is responsible for providing safe, compassionate, and comprehensive nursing care to patients and their families with complex healthcare needs. So I want you to think about practice settings where RNs are required are oftentimes practice settings where patients present with complex healthcare needs. So legal recommendations still point to RNs overseeing the administration of blood and some other critical IV medications. Some states allow LVNs to perform IV therapy if they take a course and become IV certified. And this is because RN programs typically cover IV therapy with greater depth and breadth, which allows RNs to more safely administer IV medications. Therapeutic communication is introduced and taught during LVN school. However, RN school provides further teaching on mental health disorders and therapeutic communication in the context of those mental health disorders. So RNs end up being better prepared to deal with the communication aspects of the nurse-patient relationship. Lastly, LVNs provide a lot of patient teaching, but they may not have received as much training in identifying factors that will affect patient learning. So barriers or things that are really beneficial. So RNs are often looked to when education is needed for individuals, families, and community groups on wellness topics even. RNs may be called on to provide in-service classes to other staff. So no matter the licensure, nurses make a difference for every patient we care for. I personally am glad you've chosen this path to become a registered nurse, and I hope you are eager to assume new responsibilities as you progress through the RN program. So all RNs, whether they are associates prepared or baccalaureate prepared, will take the same NCLEX test. So you may see more job opportunities open up by pursuing your baccalaureate degree, but that's not necessarily a guarantee in every area. In Texas, as far as I know, there's one diploma program, that's Covenant in Lubbock. Diploma programs are very heavy on clinical hours, and those students really focus on patient care and management aspect role of the RN. There are in Texas approximately 69 associate's degree programs, which is what you are attending right now, and there are about 60 baccalaureate programs. Now, hospitals with a higher percentage of baccalaureate prepared nurses have shown better patient outcomes. The Institute of Medicine had called for 80% of the nation's nurses to hold a bachelor's degree by 2020, so to try and improve patient outcomes across the country. In April 2021, the National Council of State Boards of Nursing released findings from the 2020 National Nursing Workforce Survey, which showed that 65.2% of the RNs were prepared at the baccalaureate level or higher. Master's degrees in nursing typically take an extra 1 to 2 years beyond a bachelor's degree. However, there are a lot of creatively built BSN, MSN combined programs, which might be something that you want to look at when you're done with your ADN degree. And doctoral degrees usually take an extra 4 to 7 years, and a PhD usually focuses on research, while a DNP usually focuses more on clinical practice. Regarding accreditation of nursing programs, your nursing program has to be accredited in order to take the NCLEX. So what is kind of the history about that? In 1938, the National League for Nursing Education started providing accreditation to schools that met its standards that it had started defining back in the late 1800s. So it did go through some iterations before becoming what we call ASIN in 2013. And that's who Amarillo College is accredited by, ASIN. There's another nursing organization that provides accreditation for a baccalaureate and higher programs, the CCNE. Accreditation is voluntary, but you might find that some schools won't accept transfer credits from other non-accredited schools. After you gain some experience in a nursing specialty, you may qualify to sit for an exam that will help you help provide you with a certification in your specialty. So those are provided by the ANCC, or the American Nurses Credentialing Center, and they will provide credit for a lot of your continuing education credits. Sometimes your employer may provide some sort of financial benefit for you to go ahead and get those certifications. And even if not, honestly, they're really good to demonstrate that you are pursuing growth in your nursing career. Regarding scope of practice, this identifies the responsibilities of nurses depending on their preparation and licensure. So, scope of practice may change in each state just a little bit by individual state nursing practice acts. The individual state boards of nursing, which are located within varying government organizations at the state level, usually exist to protect the consumers of nursing care by regulating the profession. So, if we have standards for nurses, then we can have a higher likelihood of being able to ensure our consumers, our patients, or our clients, that the quality of care that they receive is going to reach a certain level. So if you want to, now you can use your smartphone and scan the QR code and hit up the Texas LVN and RN scope of practice. You can see there LVN scope is 15.27 and RN scope is 15.28. The National Council of State Boards of Nursing is a cooperative board that administers your NCLEX test, and that allows the RN role to have some continuity across all states. So all RNs, and no matter what state you go to, will have had to pass the NCLEX RN. The ANA is the American Nurses Association, and it has decided on 17 national standards. The first 6 standards are easily recognizable as the nursing process. So all nurses must be able to perform the nursing process. And a lot of times when we think about patients, we think about them in context of the nursing process. So we have assessment, diagnosis, outcomes identification, planning, implementation, and evaluation. The next 11 standards are for professional performance. And as a nurse, these are things that you might be measured by. So when you look at it, it can feel like a really long list, and you don't have to be perfect, but they are standards that each nurse should continue to improve upon throughout the course of their career. So I have a sample practice question, and this one's regarding scope of practice. So it says, which statement indicates that the nurse correctly understands the 11 standards of professional performance? One of the 11 standards is, number 1, communication. Number 2, outcomes identification. Number 3, critical thinking. And number 4, accreditation. So when I take a look at this list, what I'm going to do first is I'm going to notice that outcomes identification is one of the first 6. It's part of the nursing process. And I know that accreditation is for nursing programs, and it doesn't really have to do with the nurse scope of practice. So then I look at the remaining 2, communication and critical thinking. And when I look back at the 11, it includes communication, but critical thinking is not listed on here. So I'm going to choose answer 1. And if you chose answer 1, then you would be correct. All right. So the Nurse Licensure Compact was developed by the National Council of State Boards, and this allows nurses in compact states to work in other compact states without obtaining a license in that state. So it's really helpful if you want to work in nearby states. Let's say you live near a border between 2 states. You can work in both states, or you can work in the other state near to where you live without having to go through the entire process of getting a state license for that other state. The nurse licensed in one compact state and practicing in another must adhere to the laws of that compact state. So, this requires those nurses that choose to work in multiple states or in a state other than their own, they have to stay abreast of any changes to the multi state licensure. So, the licensed practical nurse, again, it's considered directed in that they will work under the direction of an RN, a physician, or another healthcare provider, like a nurse practitioner. They are prepared to provide care in settings where patients are experiencing common health problems with predictable needs. And so the LPN and the LVN are sometimes considered what you call the technical nurse. Whereas, let's talk about registered nursing a little bit. So, Florence Nightingale believed the role of nursing is to put the patient in the best possible condition for healing to take place. So, the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations occurs under kind of like the scope of the registered nurse. So there are three primary ADN roles. If you'll notice, a lot of your course objectives, when you look at your syllabus or your course manual, a lot of your objectives are going to be framed by these three primary ADN roles. They are provider of care, manager of care, and member of the profession. So, the future of nursing, there are four key elements that will help lead change within the profession. Culture, society, and the healthcare status of our nation changes. And so the profession of nursing has to be able to change along with the people that we're providing care for. So there are four key elements that have been identified that will help lead change and advance health. The first one is that nurses should practice to the full extent of their education and training. Nurses should achieve higher levels of education and training through improved education system that promotes seamless academic progression. You are currently in a program where we are building connections with other colleges, universities, and even hospital facilities in order to try to do that for as many students as we possibly can. Nurses, the third one is nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. So I have a small example, and it's not a great example, but it's a small example. I went to work in an office that had been newly built, and no one asked the people who work in offices how it should be designed. So we had lovely cabinets, tons and tons of lovely cabinets, but none of them were deep enough to hold a binder. So all of our binders still had to sit on our desks, and the cabinets remained mostly empty. So that's where, when we talk about number three on this page, you want to think about we can't redesign healthcare without the input of nurses because we're a very important, integral part of how healthcare is provided and delivered to our patients. So if it's redesigned without our input, things are going to be designed and implemented that don't make sense. So we have to participate in that. The last one is effective workforce planning and policy making require better data collection and information infrastructure. So I want you to think about times where the nurse role might be pulled into something like your IT department. Your IT department may have one or more nurses that now work more with computers and really don't ever take care of a patient. And there's still nurses. Those are still nurses. And they are helping lead the profession. They're helping to take care of nurses, right? Provide support. They know what we need because they are one of us. But in addition to that, as changes come down regarding technology, they are there to help ensure that good data collection and information and infrastructure can take place so that our profession proceeds in good fashion. Um, I liked this little cartoon. It may be difficult to read because of just it didn't expand and still stay very clear. So it says, nurses work 12 hours a day, 4 hours caring for patients, and 8 hours washing our hands. I just thought it was kind of cute. Sometimes it feels like that's true. Um, and these days, sometimes it feels more like 4 hours caring for patients and 8 hours documenting. I want to encourage you at this time that as you move from the role of LVN to RN, that you go ahead and accept some of the changes that will happen with your role transition. Perhaps you will take on a role where there is more computer work or something that doesn't feel as fulfilling as what you've done in the past. And I just want to encourage you that all positions are important and they do help to provide a better quality of care for the patients, whether or not you ever are touching a patient. You are still helping to provide a better quality of care for patients. If you have any questions, you can email me through the course or at jrgenn@actx.edu, or you can reach out to your local instructor.